Thank you so much to Professor La Rosa for the invitation, and I'm really happy to have this occasion to speak here with so important engineers all over the world. I'm Eugenio Pedula, I'm a researcher in dentistry, and I have the pleasure to work with Professor La Rosa on the aspects of these strange instruments, endodontic instruments of the dentists. And we have performed a lot of research on the fracture of these instruments for cycle fatigue, and with Professor La Rosa for torsional resistance. So, and just to speak about a little bit about endodontics. Endodontics is the root canal treatment, and this treatment is composed by different phases. We have the first phase is the shaping with these kind of instruments. Then we have irrigation, and then we have the obturation of the root canals. The success in endodontics is that the bacterial disinfection of the root canals, and for this we have two weapons, the NiTi instruments and the irrigants. So nowadays the best endodontic preparation of root canal is a chemomechanical preparation using this kind of instruments and using using the irrigants as sodium hypochlorite, EDTA, and etc. For sure, we would like to preserve the results with a 3D obturation. The problem is the environment. We have a fight with this bacteria in a very, very terrible environment, because this is the anatomy. This is a 3D reconstruction of a real tooth by a micro CT scan that I have performed in another study with my friends of King's College in London. And as we can see, these two roots have a communication. We have here many exits, not only one. And in the nasal root we have two canals as usual, but here we have a joint and accessory canals. So it's really impossible for the stainless steel or NiTi instruments have the possibility to reach all the anatomy of the root canals. So in the 1974, it was the first. We had the first paper about the mechanical instrumentation by stainless steel manual instruments. And in 1988, this is the first paper that proposed the use of NiTi to produce the NiTi endodontic instruments that we also call files. Instruments or files, it's the same. Okay. From 1988, it's just past 28 years of nickel titanium. This is a 3D representation of a NiTi instruments that work in continuous rotation inside of a root canal. And the introduction of NiTi, it was a great advantage for endodontic therapy, because, and especially for mechanical instrumentation, because we have a lot of advantages thanks to the nickel titanium alloy. First of all, we have the possibility to create tapered instruments. So in the past, the stainless steel instruments, it was only O2 taper. So to perform a root canal treatment, we need to have a lot of stainless steel files, and the root canal treatment was very time consuming. So thanks to the flexibility of NiTi, we have the possibility to have an instrument with a large taper, and so we have the possibility to reduce the number of instruments and have easier and faster preparation. And moreover, thanks to the flexibility of this shape memory alloy, we have usually preparation more centered into the root canal. Okay, so this is the simple results today. At the beginning, Weiler in his paper says that the NiTi have also the advantage of no breakage, but unfortunately, in few years, we have the possibility to know that unfortunately nickel titanium instruments fracture and fracture more than stainless steel instruments. These are some pictures of failure surface. The mechanism of NiTi instruments fracture, and this is the incidence. It seems little, but if we have think about the high number of root canal treatment that just now in this moment in all over the world are performed, this is not a very low number. And the reason for a fracture of NiTi instruments are always the main reasons are always cycle fatigue when an instrument is in a curve, and torsion and torsional breakage, especially when the root canal is very thin, constricted, calcified, etc. But really, in the clinical practice, it is more reasonable that we have a combination of these two failures. Some papers, this one, it was one of the first, and I am Professor Rosa, I published another paper about the connection about the cycle fatigue and torsional resistance. The NiTi nickel titanium is a shape memory alloy, and it is characterized to two crystalline phase, austenite and martensite, austenite rigid and martensite flexible, and we can change this phase using the temperature. With cold, we have the possibility to skip from austenite to martensite. For sure, we usually with hot we have the passage from martensite to austenite. With cold, we have the passage from austenite to martensite. So the problem is the transitional temperature, and today we have the possibility to have thermal treatments in order to change this transitional temperature. Some literature, and so. Moreover, the NiTi instruments are made by grinding process usually, but today it's possible also produce these instruments for electric discharge machining, as in this case, and this is the surface differences about an instrument made by grinding and made by electric discharge machining. Thermal treatments influence for sure the macroscopic characteristics of the instruments, as for this instrument that is in austenitic phase, or this other one that is in martensitic austenitic phase just at room temperature, because this is an heat-treated instrument. But for sure, also torsion and cycle fatigue resistance are influenced by thermal treatments. Some papers about cycle fatigue, some paper about torsional resistance, but we have only few data. For this reason, we have produced this study and performed this study on the influence of heat treatment on torsional resistance of fracture of nickel titanium endodontic instruments. We have tested this kind of instruments, two 2508 taper, 1 cm ADM, 1 MY, and 3 2506 taper, 1 cm, 1 MY, and 1 in traditional NiTi as reference. So, this is the same machine that just the Professor Rosa has speak about in the previous lecture, and this is only the final part of the test. All instruments test at 2 RPM because this is the ISO standard, 20 instruments for all group. 3 millimeter from the tip is the point of to clamp the instruments. This is the results. We have only the representative curves. These curves and the SM images after are the same figures that we have published on Procedure of Structural paper of this Congress. And we have the possibility to view that Way 1 and iFlex ADM have for sure a very different curve, where Way 1 for the probably for the NiTi, for the type of NiTi, and while we have a very direct load and then change the slopes only at the end and then fracture. Instead, iFlex ADM go up and change the slope in many points, and after a very long time they fracture. It's very similar if we have the possibility to view the graph of the 2506 instruments, and while similar to A1 a little bit, for sure also the cross-section have an influence in this. CM is the same alloy of ADM, but it's very similar also the curve, and this is the curve of NiTi instruments. This is the data, and we have two values, the torque load to fracture and the angular rotation to fracture. And so we have the possibility to view that Way 1 have the higher results as torque than iFlex ADM, but lower results and about the angular deflection. Speaking about the 2506 instruments, we have the possibility to view Protaper Next X2, and while the best results are torque, again, and CM the worst results again, and in the middle the NiTi, traditional NiTi F6 K taper as torque, but in a very opposite view. For angular rotation, we have the results different. So Way 1 the worst, CM the best, and in the middle, as usual, the NiTi F6 K taper. The comparison of specific files, we have performed a comparison of specific files and not a systematic investigation. It's not possible to compare the results of 2508 instruments with the results of 2506 instruments, because obviously the design, the dimension, the cross-sectional area, the metals, the percentage of metals are totally different. So we would like only compare the 2508 and the 2506 among them. And data were compared between instruments that have the same dimension, tip size and taper. Yes. Way 1 showed higher torque but lower angular deflection than iFlex ADM, and this is probably due to the different heat treatment, because we have performed the measure of the cross-sectional area at the point of breakage at 3 mm, and we have the possibility to view that we have a non-statistical difference for the area of this cross-sectional area, this cross-sectional design. So probably this is the reason, and why probably is a little bit more austenitic, more rigid, more capable to resist of a torque, a load, a stress for torsional test. And probably instead, CM, crystalline phase of NiTi, is more flexible because it's just a martensitic phase, just at room temperature. And so for this, have a lower torque, but a great flexibility and the possibility to have a higher angular rotation. Speaking about the 2506, is the same. Protaper Next showed higher torque but lower angular rotation deflection than iFlex CM, that is similar to iFlex ADM, for the same reason of that I have said before. iFlex CM showed higher angular deflection but lower torque than F6 K taper. What this means? the CM wire have a higher angular deflection than NiTi, and this is for sure for the heat treatment. But in this case, we have a lower torque than F6 sky taper, and this is for the same reason. The very important point is this one. F6 sky taper showed higher angular deflection, but same torque than ProTaper Next. Probably this because M wire of ProTaper Next is a little bit more flexible than traditional NiTi. But on the other hand, F6 sky taper have a cross section very sorry for the number, is okay, is here, is 80. Have a cross-sectional area very lower than ProTaper. So probably we have the same torque because in one end the heat treatment of ProTaper Next is more flexible, but on the other hand the grit and the big cross-sectional area of ProTaper Next compensates the first aspect. And with this, I would like to thanks for your kind attention. Thank you so much.